My name is Elizabeth Day, and I'm going to be talking about central line associated bloodstream infection reduction in adult ICU patients. First, I want to talk about the importance of CLABSI reduction. First, I want to tell you why this is important to me. I work currently in the neurotrauma ICU at Mercy, and we are having an increased rate of CLABSIs at the moment. We are working on implementing the bundles that our hospital currently has with our unit-based council. So along with this being very important to me personally, it's also really important to my patients and all patients. There's a 12 to 25% increased mortality rate in patients that get a CLABSI. Hospitals also accrue a pretty high cost when it comes to this. It's $16,500 per person who gets a CLABSI. There's also an increased length of stay, which is approximately 3 ICU days. And it helps hurt staffing. It doesn't leave ICU beds open. And it delays patients being able to get out of the ICU and be one step closer to going home and being with their families. My PCOT question is, for adult patients in the ICU, which is my population, does a CLABSI reduction program, the intervention, compared to no consistent intervention comparison, lead to a decreased rate of CLABSI outcome over a 6-month period? That's the time period. For my article search, I used the Progressive Nursing and Allied Health Sources database. I started with the search terms ICU and adult and CLABSI and prevention. This turned up 180 articles, which is a pretty extensive list to go through, so I did make that a little bit smaller. To narrow the search, I changed the articles from only 2011 to 2018 and only full text. This brought me down to 121, which is still quite a few to go through, but I was able to look through them all and choose 5 articles. I chose articles that were in my wheelhouse of interest, that talk specifically about bundle use in the ICU, and the years that I chose are the years that I've been involved in nursing care, either as a student nurse or as a bedside nurse. These summaries all had the similar outcome, that they showed a decreased number of CLABSIs post-study. One study looked at using a daily chlorhexidine bath to lead to a decreased number of not only CLABSIs, but MRSA, VRE, and VRE in patients. In a study done by Nolan, Callcutt, and Carton-Seba, done on patients in a medical ICU where bundles were already implemented, there were very few symptomatic CLABSIs and CRDVTs. Patient length of stay or mortality was decreased throughout the course of the study in all ICUs in a study done by Ista et al. In 2016. A 2018 study done by Urshova et al. Focusing on neuro-ICUs in Russia showed that implementing HAI prevention measures led to not only decreased CLABSIs but also other HAIs. And finally, in a study done on trauma patients by Smith, Eggers, Franklin, Harbrick, and Richardson in 2011, there was a drastic initial decrease of CLABSIs along with 2-year post-study improvements. Some inconsistencies that I found were all of these bundles were a little bit different. So in our first bundle, the critical implementations made were increasing hand hygiene and also isolating patients that already had infection to prevent patient-to-patient spreading of disease. This was done by Urshova et al. In 2018. A daily CHG bath was used on each patient to study the efficacy of CLABSI reduction by Kim, Lee, Rowe, and Shin in 2016. The 2016 study by Nolan, Callcutt, and Carton-Seba looked at the infection rate of lines in a hospital where bundles were already included in being used on a daily basis. And those included insertion bundles and maintenance bundles, which the insertion was very strict sterile procedure, and the maintenance bundles included daily observation of the lines and a sterile dressing change every 2 to 7 days. Ista et al. had a 2016 study where CLABSI bundles included also both insertion and maintenance, with insertion focused mostly on full sterile insertion and CHD cleansing prior to. The maintenance included hand hygiene, evaluation of the actual need for the central line on a daily basis, and antimicrobial cleansing before central line manipulation. In the trauma study done by Smith et al. In 2011, a 5-step bundle was implemented, including education of the staff, a central line care kit, daily evaluation of need for the central line, checklist to ensure adherence, and strict daily nursing regime. The gaps in these studies included the number of studies involving CHD baths to decrease infection conducted after 2013 is lacking, according to Kim, Lee, Rowe, and Shin. Urshova et al. In their 2018 study made the point that there's room for a study to look at the relationship between decreased HAIs and decreased antibiotic resistance. Some limitations to these studies were listed in all of them. According to Nolan, Cawcut, and Carton-Seba, the largest limitation in their study was not being able to assess the need for the central lines in each individual patient, which could have changed the outcome as to whether they had a CLABSI or not. In Urshova et al.'s 2018 study, they only looked at the high-risk neuro population, and they typically have a higher HAI rate than overall ICUs. Kim, Lee, Rowe, and Shin in a 2016 study noted that not all ICUs studied used a consistent mix of chlorhexidine for the bathing. They ranged from 2 to 4%. In a 2016 study by Ista et al., there was a moderate variability in what was used in each bundle in different ICUs. In the 2011 Smith et al. Trauma study, only trauma patients whose central lines were inserted under emergent conditions were evaluated. In conclusion, does the evidence support change? Absolutely. In all 5 research articles, there was a positive change related to a bundle of some sort already being used or being implemented during that study. As far as guidelines go, Mercy Hospital does have a guideline that they use for central line. I have a snippet here from their central line policy, which talks about dressing changes and changing the IV lines, as well as evaluating daily if these are needed for each particular patient. Also, a central line insertion checklist, which goes along with the insertion bundles, is listed in one of Mercy's policies as well. So, do these articles support the practice guidelines? Yes. They all talked about the use of a bundle in both maintenance and insertion, which we use at Mercy. Thank you for your time.